Olá,
Hello and
bem-vindos e
welcome to
bem-vindas
everyone
ao
to the
webinar
webinar, The
do
Use
uso
of
do
REDCap
REDCap
Beyond
para
Surveys and
ENG,
Typical
dicionário
Databases,
e banco de
Efficiency
dados,
in
eficiência e
Research.
pesquisa. Esse
This
webinar ele
webinar
está
is
sendo
organized by
organizado pela
Fiocruz and the
Fiocruz
Global
e
Health
pela The
Network
Global
of
Health
the
Network
Oxford
da Universidade
University.
de Oxford. Meu nome é Vanessa, eu sou
I'm
pesquisadora
Vanessa, I'm
e
a
estou
researcher
coordenadora de
and
informação e
coordinator of
comunicação da Vice-Presidência de
the
Educação,
Vice Presidents
Informação e
of Education,
Comunicação da
Information and
Fundação
Communication
Fiocruz,
of
Fiocruz, e
Fiocruz
estarei aqui
Foundation.
hoje mediando esse debate.
I'll be here today
Antes de começarmos o evento, gostaria de
for this
agradecer a
debate.
toda a equipe da
Before
Fiocruz
beginning
e da
this
Global
event,
Health
I'd like
Network,
to thank
que se
the Global Health
dedicaram
Network and
tanto à
Fiocruz team
organização desse
that
evento.
dedicated so
Espero
much
que vocês
in organizing this
aproveitem
event.
o que
I
preparamos
hope you
e
take a good
já nos
advantage
colocamos
of
à disposição
what
para
we've
futuros
prepared, and
contatos.
we are available for
Queria
future
começar com uma breve
contacts. I
reflexão
wanted to
sobre as
begin with
questões
a brief
que envolvem o
reflection
nosso
on the
webinar,
issues that
o
involve
uso
our
de
webinar,
dados
the
para
use of
descobrir
data
padrões, prever
to find
comportamentos e gerar
patterns and understand
conhecimento
behaviors and
amplamente
generate knowledge
discutido e
is
adotado à medida que
has
enfrentamos
an
cenários
amplified
diversos e
discussion as
complexos.
we
O campo das
face
ciências da
adverse
saúde também
scenarios.
convergiu para o
The
uso
field of
dessas
science and
tecnologias
health
para
converge to these
criar conhecimento
technologies to
científico.
create
É
scientific
fundamental
knowledge.
explorar o uso
It's
prático de ferramentas de
fundamental that we
ciência de
explore
dados
the
para apoiar
practical
o
tools
desenvolvimento da
of
pesquisa
data
em saúde.
science to
REDCap
support the
é um
research on
acrônimo
science.
de Research
REDCap
Electronic Data Capture,
is an
uma
acronym,
plataforma
research
digital
electronic
amigável para
data capture.
coleta,
It's a
gerenciamento e transferência de dados de pesquisas
friendly
para
tool
outros
for
sistemas de
transfer of
compartilhamento, por
research
exemplo,
and
como
other systems
repositórios de dados de pesquisa,
of
para
sharing, such as
compartilhamentos e preservação
research
digital.
repository for
Pode
conservation
ser
and digital
utilizado em
preservation.
diferentes tipos de
It can be
pesquisa
used
e
in
também para
different kinds of
atender as demandas de
researches and also
serviços
to
e
attend the
assistência.
demand of
O
services and
REDCap é um sistema
assistance.
composto por
REDCap
ferramentas
is
que
a system
permite o
composed
gerenciamento
by
dinâmico
tools
de
that will
dados por
allow
meio de formulários
a
eletrônicos,
dynamic management
importação e
of data
exportação de dados,
through
construção de
importing,
relatórios
exporting data,
reproduzíveis
and building
e inclui o uso de
reports
informação de
that can be
pesquisa entre
reproducible,
colaboradores de
and
diferentes
explore the
departamentos e
collaboration
instituições
between
acadêmicas.
different
Ele tem
collaborators of different
flexibilidade, recursos e
universities.
funcionalidades.
It has many
Acima de tudo, é
functionalities, and
gratuito,
it's
o que
also
é
free,
vital para
which is
pesquisadores
vital
que trabalham em
for
condições
researchers that work
de
in
recursos limitados e
limited resources
estados muito
condition,
escassos,
such
como
as the
pesquisadores do
South
sul
Global
global.
researchers. I'd
Então,
like to
pensando na criação
ask
de
you
um
to mute it.
ecossistema para o
So
uso da
thinking about
ciência de
a
dados
creation
na
of
pesquisa em
ecosystem for
saúde,
the
em
data
cada
science in
instituição,
research for health,
país ou região
each
do globo,
institution in
precisamos de
country or
políticas e
city,
diretrizes
for
para
all
gerir o
that we need
compartilhamento e abertura de
policies
dados,
for opening
alinhadas às
data
questões
and sharing
éticas e
data
morais
aligned to ethical
locais.
and legal
Precisamos de
issues,
capacitações e
local issues.
desenvolvimento de
We need
competências para o
capacitation and
uso.
development
Precisamos
of
formar
competence for that
parcerias,
use, and we
redes
need to
e
form
infraestruturas e
partnerships
ferramentas
with
capazes de adaptar
infrastructure
esse
and tools that are
cenário para
capable of dealing
pensarmos
with
em
this
acesso
scenario
federado a dados.
to think
Então, na
about a
Fiocruz,
federal access to
somos
data. So
todos
in
aqui
Fiocruz,
hoje
we
Fiocruz e vamos
are
trazer
all here,
nossas
Fiocruz, and we
experiências aqui para
want to
vocês,
bring our
entendemos que o
experiences to you.
REDCap é uma
We
importante
understand that the
ferramenta para a
REDCap is an
composição desse
important tool
ecossistema.
for the composition of this ecosystem.
Tem algum microfone ligado? Eu peço, por
There is
favor, me
an
ajudem.
open mic. I would
Nesse
please ask you
webinário,
to
nossos
mute
convidados
it. In
descreverão as
this
maneiras
webinar,
pelas quais o
our
REDCap pode ser
inviters will
usado para
describe the
melhorar a
ways that
qualidade
REDCap
dos
can be
dados,
used
tornar a coleta dos dados mais fácil e
to
eficiente, reduzir o
make the
custo e
data
acelerar o
collection more efficient and
trabalho
reduce
no campo.
cost and accelerate
Discutir
the
as
field work.
possibilidades e variações do uso do
Discuss
REDCap
possibilities and variations of
e
the
sua
REDCap use
adaptabilidade às necessidades da
and its
pesquisa.
adaptability
Abordará
to the
alguns
needs of
requisitos
the research.
técnicos
Also
mínimos de
approach some
gerenciamento
technical
administrativo e de
issues
segurança.
for the minimum management in terms
É,
of safety.
Vamos dar uma olhada em quem se
Great. So
inscreveu
let's
para o
take a look at this
webinário.
map.
Então, somos
Those
mais de
who subscribe to this webinar, we are
2.722
more than
participantes de várias partes
2,700
do globo.
participants
Next,
from
please.
all over the world.
Vou apresentar algumas
I'm going
orientações
to
sobre a
present some
dinâmica. Em primeiro
orientations
lugar, essa sessão está sendo
about this
gravada.
dynamic. First of
A
all,
gravação
this
será
session is
compartilhada
being
nas
recorded
próximas
and
semanas
it
na
will be
plataforma da
shared
The Global
in the
Health
next few
Network,
weeks in the
Fiocruz,
Global Health
e
Network and
América
Fiocruz
Latina e
platform,
Caribe.
Latin America and the
Esses materiais
Caribbean.
podem ser
This
encontrados
material can be found
usando o link que será
and
compartilhado no chat.
using the link that we will use in the
Esse
chat.
webinar
This
será
webinar
realizado em
is
português,
in
está sendo
Portuguese
realizado em
and you have
português,
simultaneous
contém
translations for
tradução
English and
simultânea para
Spanish.
inglês e espanhol.
You can use
Na tela,
the
né,
toolbar, click in language, interpretation, and choose the language that you desire. Due to the number of participants, your video and mic were muted. Next, please. Use the chat resource for letting us know if you have any technical issues. The Q&A and the interaction will be helped by Fiocruz team. Use the Q&A feature to post your questions. You can post anonymously. We have dedicated time allocated for Q&A, so we'll try to get through as many questions as possible. We have a specific time dedicated for that, so we'll try to answer as most questions as we can, as many questions as we can. Very happy to be here with Leandro Amparo de Souza, with Margaret Catoia Varela, with Ana Paula Esteves Pereira, and André Bastos Dyer. Our agenda for today will have some presentations. First of all, will be the introduction to REDCap in research. Then the second one, REDCap in real life, practical applications. Managing large volumes of data in REDCap. The birth in Brazil experience. Advanced resources in research project management. The Sakura Project experience. And REDCap software management. We'll also have at the end, as we said before, discussion and Q&A through the Zoom button. Here are some links, interesting links for today's event. Our team will make it available throughout the webinar. Now, we would like to introduce our experience here. So first of all, we would like to know from you if you could answer the poll that is going to be made available for you to understand what's your experience with REDCap, if you have any, and what is it. I'm going to introduce now and say welcome to Leandro Amparo de Souza. Leandro is a clinical research data manager at a clinical research platform at the Vice Presidency of Research and Biological Collections from Fiocruz Foundation. He is experienced in the computing science with emphasis in data bases and clinical researchers. He has an experience with REDCap from its first steps in 2014. He has trained more than 80 people only this year in using the REDCap, including local researchers and open practices. Leandro, I pass the floor to you. Thank you, Vanessa. I think you got it, right? Okay, good morning to everyone. As Vanessa introduced myself, I don't have to talk too much about me. I want to talk more about REDCap because we don't have too much time. So I'm going to begin with an introduction of what REDCap is and talk a little bit about REDCap Fiocruz, which is an initiative that we created from the Vice Presidents of Research and Biological Conditions, which is to make available REDCap for the whole institution in Fiocruz. So what is REDCap? REDCap is a secure web application for building and managing online service and databases. While REDCap can be used to collect virtually any type of data in any environment, it is specifically projected to online and offline data studies and research. REDCap was thought for clinical research, but we use REDCap for many things. So anything that is thought about research, we can be used in REDCap for all data capture in our platform. And we even control the holidays of our collaborators through REDCap and vacations as well. There's also the consortium REDCap, which is a vast support network of collaborators. It's composed of thousands of active institutional partners in over 100 countries who utilize and support their own individual REDCap systems. They exchange ideas, knowledge, because since the system is a free system, the university that created the REDCap, they cannot give the support to everyone that uses REDCap. So they created this network for the collaborators to help themselves. So it's a vast support network. Some functionalities of the REDCap, I want to, hold on, I forgot to change slides. So it exports data to Excel, PDF, SAS, Stata, R, or SPSS. For any softwares for statistic analysis, it exports in the XML. I forgot to put it here. It's a programming language. It has a calendar to building. It's a building project calendar and scheduling module to organize events and appointments. It can create email contact lists, personalized invitations, and track who responds. That's for what they call the surveys, the polls, the online polls. And they send a link for the person to answer. And from that point on, you can personalize invitations, create forms with a public link that can be sent by email or posted on a website. So you don't need to know who answers. You just post it on the website for people to answer. The system has an auto-validation calculated, fields, file upload fields, branching logic. What is that? It's the auto-validation is when we can add an interval in the fields. So I want to say participants from 18 to 60. So I put a value minimum of 18, a maximum of 60. And the system will accuse an error if it's typed without this interval. The calculated fields we use for IMC, but we can calculate anything like data interval, age interval, file upload. We can storage files in the system, TSL or images. Some projects we use image, and branching logic is it well, it won't show some fields. For example, if we're gonna ask someone if they are pregnant, we're not gonna ask from the male sex, this kind of question. So from the male gender, so we won't let that show. And the REDCap APIs options to use the remote application. We connect directly to the REDCap to bring this information in real time. We create graphics and many other things. We can use the Power BI, Tableau. We do within the REDCap connection from project to project using the APIs. This is the page, the REDCap page, the official REDCap page, the project redcap.org. Some statistics you see there on top. More than 6,900 institutions with 155 countries, more than 1.9 million projects that use REDCap today, 2.9 million users, and more than 35,000 citations of REDCap. This is an example of form for REDCap. We have all these fields. We have open text field, data field. We have the suspended list that you can choose the options. Data field, the place where you can only choose one option. The kind of matrix with the same question for many answers. And I'm going to talk a little bit about REDCap Fiocruz now. Our initiative is to make available for the whole institution. We began our FF was searching for Project, which is the ATI for Fiocruz, to install REDCap at the FF because they didn't have resources for that. And Chicken asked for me to give them the support. That time, REDCap was only used in the vice presidency for its projects, and we decided to migrate to the REDCap Firecruise, the institutional REDCap, to make available it for the whole institution. So we began that with IFF. We hired a person that was working with them, and we trained this guy for 2 weeks to be the local administrator for the REDCap. He administrates the users' accounts, and besides that, we created a work group in this same period, together with the other units that were participating. And with these local participators, we created a local work group, and we train and exchange experiences, and we created a discussion forum, which I'll talk about a little bit later, to give support for the units and also for knowledge exchange. And we began also the implementation in other Fiocruz units, which is ongoing. We have some units using REDCap currently. Those are the ones. Actually, it all began, and it will be said about that later on, but on NSP, it began using our REDCap. And when we decided to migrate to institutional REDCap, we introduced the IFF at Fiocruz with this new format, the IFF institutional. This is the list that use Fiocruz Ceará, Fiocruz Rondônia, IFF, COC, Oswaldo Cruz House, Fiocruz Amazônia. Some are migrating from its own REDCap. The last one that got in was the Polytechnic School of Health. We are also training them. They got in September. They joined us. And we also do some support to the units. We have monthly meetings. At first, it was only with administrators, local administrators, every first Monday of the month. We exchange ideas, we clarify some doubts. It's an informal conversation about the system. And today we've opened to not only administrators, but anyone who wants to join. It's a moment that we have, an hour that we have to clarify any doubts. And we created an institutional email for each unit. It's fiocruz.com.br. And for every institution that begins, that joins, we create a new email. And we also have a forum of discussion for REDCap's Fiocruz community. It's a virtual campus. It's the same idea, but it's an official REDCap forum with knowledge exchange, questions and answers. We have the REDCap minutes, which are explanation videos of 1 minute at most, with each functionality of the REDCap. We have guidelines, presentations, we have REDCap guidelines, we have frequent asked questions, some useful links, some general informations, and training material. Every training that we give in REDCap, we storage there to anyone who wants to use it. You just need to use the QR code, the access QR code to this virtual campus, the virtual Fiocruz community. Here we have a discussion forum. As I mentioned, to discuss, we join in, ask questions, and sometimes your question, which is interesting, your question might be the question of someone else. And so it's important to ask those questions, to share that so other people clarify their doubts. And we are able to populate the forum with Q&As, and the person can join us with any doubt that she might have. So we know how to create a new project, how to create a text field, and we include more and more as we go. We have here why use, with the quality of the system, the quality of data that are always there. We have robust data in the system.
It is hosted in the safe room. The system is backed up every day. It includes all of the safety, security policies, proxy, firewall, and everything. The ease of use, I mean, friendly use, is great. I mean, it's super simple. Those who use a REDCap know it's a very simple system. It doesn't have those complex things that people usually prepare. We'll talk about the complexity of the complex forms that we put together, but REDCap makes it simpler. So it's available 24/7, so it can be accessed from wherever you are in the world, and all of any device can use it, including the mobile devices. So thank you. This is my contact information. If you want to contact me, please feel free to do so whenever you wish. Thank you, Leandro, for your presentation.
Obrigada, Leandro, pela sua apresentação.
And now we want to welcome Margaret Cataya Varela. Margaret, she's got a degree in mathematics from the Federal University of Rio de Janeiro. She's got a master's degree in graphic computer from the Alberto Luiz Coimbra Institute for Graduate Studies and Engineering Studies at the Federal University. She's currently an Oswaldo Cruz Foundation researcher working as data manager in the research unit in immunization and surveillance and health at the Evandro Chagas National Institute of Infectious Disease. She's a graduate program student in public health in the Federal University's Rio de Janeiro's Institute of Health, Public Health. She's a visiting researcher in the University of Universidade Nova de Lisboa. Margaret, I'll pass the floor to you right now. You are welcome to our program. Thank you very much. Good morning, everybody.
Obrigada, bom dia. Minha apresentação vai trazer pouquinho da experiência de
My presentation is going to share the experience of practical applications using the basic resources, but also advanced resources, so that we can have an overview of how rich REDCap use is in research and data management.
Então, a primeira experiência que eu trouxe,
So the first experience I'd like to share with you
trabalho que a gente fez dentro
is
de
the work we did in the National Institute for Science and Technology, INCT. That's the acronym for the institute. That included the Fiocruz Rondônia staff. They've got this ongoing project on epidemiology of Western Amazon. And one of the projects they offer is to do data collection from riverine populations in 3 rivers that feed into the Amazon River. So they went on 3 expeditions to Juruapurus and Madeira rivers. Those are sites where internet connectivity is very scarce, or if any. And research that is usually conducted there is usually conducted on paper. But at that moment, there was a demand for us to do that on a safer manner, on a more practical manner, meaning digitally, but without involving high costs of system development. So the solution we came to was to use REDCap with offline data collection by means of apps that would be installed on tablets. The proposal included not only designing the charts, but also the logistics part of the study, and REDCap played a crucial role for that design effort. According to what we planned, we were gonna, since it was a clinical data collection project, but the project also involved collecting biological samples, there was a part in which we had to think about how to structure and do the logistics for for those samples. So we looked at setting numbers, participation numbers for the participants before the study started. So we printed labels with barcodes for the blood collection pipes as well as quota pipes. And all of that data was important into REDCap. So when we set up the tablet to be used in this project, we already had all of the numbers previously installed, previously defined. So the field team would just hand over a bracelet with the participant's number, identification number, and the person in charge of doing the clinical data collection would access REDCap through that identification number in order to fill in the data. So it was divided into field work, which was conducted on the ground whenever they would stop. So the labels were prepared to identify individuals and the quotas and the samples, and they were allocated as if they were within 3 different stations, one for personal data identification, another one with the nursing and medical team to collect clinical and anthropometric data, and one third service station, that was where people would collect blood. Those samples were then taken to the boat, which was traveling along the river, and the boat had the laboratory team who would go through the samples on the basis of the identification number that was set for each participant. That was a structured number, which included the location and everything. The logistics allowed us to have a REDCap database, which was designed on the basis of that participant identification number, and we could therefore track the sample. And at the end of the day, at the end of the study, those samples were sent to different research centers so that they could develop their research efforts based on those samples that had been already collected. During the river journey, they would collect data with, and they would not transmit that to the final database. Data collection is done by installing an app on the tablet, and they would download the charts, which are located on the server, download onto the tablet. So people would fill in the data on the tablet. They are locally stored as if you were just filling up paper charts that would then be taken to research. The difference is that it was not paper, it was a tablet. And when they came back from the journey and they had internet connectivity, they would sync the data with the server. In terms of REDCap project, down here we have a print of the REDCap screens, print screen or screenshot that contains the identification number, which was participants' identification number, and each column here will contain the charts that were filled in at each different moment of the studies. The green dot represent that. Charts for these participants have already been filled in. In terms of building charts in the REDCap, the project didn't have any further elaboration. This is the basic thing of setting up data management within the REDCap. But the point here was the user-friendliness and the low cost involved in implementing a digital data collection on the site, on the ground, where there were no internet availability. So we went on 3 different measurements along the river because the whole thing started in 2019. So the first expedition was along the Madeira River, where we collected 213. Actually, we had a participation of 213 volunteers. Second expedition was in the early 2020 along the Juruá River, and that included 250 participants. And the third expedition was eventually not implemented because we were looking at mid-2020, and that was when the pandemic started. The second proposal that I brought here is this experience with use in telemedicine and the Reference Center for Special Immunobiological Elements that operates within the Fiocruz. So it's part of the National Immunization Program. It was a research project which was motivated in 2020 because of the pandemic. This project has come to an end, but a legacy it left was a a telemedicine service that is still operating, and publication is presented here. So the big motivation for us to develop this solution, which also used REDCap, obviously, first one is that the especially immunobiological reference center, whose acronym in Portuguese is CRIE, it includes vaccinating people on a different scheme from the general population for the pre-pandemic scenario. That includes a lot of demand, but when the pandemic started, the scenario changed to be this one that you see in the lower image with empty halls. The problem there was that because of some disease or some health conditions, people could not have they could not have their vaccination scheme postponed, but they would avoid going to the CRIE center because of circulation needs. And the people who could be postponed, they were postponed. So we thought of seeing the patients through telemedicine, and postponing vaccination would be an indication that would be given through telemedicine. So people would only attend in person to the medical center, to the healthcare center, if there was extreme need. At the same time, there was increased demand in terms of doubts related to adverse events after vaccination or post-vaccination adverse events. So we went through a lot of fake news periods, and that would cause doubts and prescriptions that would make the population uneasy about resorting to the vaccines. So telemedicine was a service that could also be used for that purpose as well. The solution was to design telemedicine service for SUS patients, SUS being the Brazilian health single system. And the system operated as follows. CRIE is inside the National Infectology Service. We have an electronic service. So patients are seen through their registration in that service. The research project involved design or redesign REDCap to accommodate the flow. People would have to have an internet link so that they could log in and fill in their consent, the term of consent, and they could schedule their visit. And on the moment of the medical visit, we would resource to the National Research Network, and the medical visit was done as it is done on an in-person visit. So all records are kept in the electronic records. All of the documents which are generated for the patients would be generated in the same manner. The only change involved the signature, because on an in-person basis, the physician would fill in the form and stamp it and sign it and then deliver that to the patient. Telemedicine, it was not the same. It could not be the same. So it was only a PDF version of that document, which was signed digitally. So the file was to be included in REDCap charts. So we did use warnings and notifications to send those documents to participants. In terms of REDCap resources, we use surveys. So the first participant entry would be made by means of a link, an internet link, where people would fill in the form, TLE, and the person would then be directed to a second survey, to a second chart, where the person would then be able to provide some of the personal data which are necessary for medical visits, but they are usually demographic data or data that individuals can respond on their own. That would expedite consultation time, and that would improve service quality. I'm going to get to a few more details here, because we did use more advanced resources for this purpose here. This is a screenshot of the surveys line. So REDCap allows you to manage various forms at the same time. If they are set up in the survey format, that is when the participants themselves will respond to the questionnaire. There's no no physician filling in that chart at that moment. So we can actually direct the immediate start of a survey after one survey after another. You can do that. So here we see the first chart, which was the TCLE, which is the informed consent. And the second one, the request for scheduling a visit. And then there's a field for warnings and notifications, which is another REDCap resource that allows us to send email with whatever content we wish. And we can actually schedule that according to criteria, different criteria. First one, for instance, if the person has requested a visiting time, on the eve of that visit, we send an email. We send it, that is scheduled within the REDCap, so that on that date, if the person did accept the TCLE, and that's included in the study, and then the person filled in the charts, the proper charts, that will trigger an email on the eve of the visit to inform the person that the visit is scheduled at this moment and of the day. And here we have this warning number 6, for instance, which shows a rule we put together for automatic dispatch of the documents which are generated during the visit. So one chart is filled in by the physician at the end of the visit. All of that would be uploaded to the electronic record system. And that would also say whether an email had to be sent with the files, with the relevant files or not. So when the chart was saved, we would automatically trigger an email to the participants, including the attached files. So we use the surveys, a survey line, file upload, and warnings and notifications. All of these services were used. And that required 2 different projects within the REDCap. One was where the project charts were made. That was the main project part of it. But we also had a support project, which was involved with scheduling the visits. So in this auxiliary project, we had a chart which included the different times and a little bit more information, but basically the times for visits and a field to say whether that was available or not. The idea was that the main project would provide an SQL field, which is a programming language for database. So we would have that field for SQL. This is advanced research. The data entry trigger with a PHP script, which was automatically triggered when individuals would pick up a time. So the idea is for participants to enter the system, fill in the TCLE, and then be taken to a screen which includes a suspended list field, as Leandro showed. And then when the person selects a time, which had been already previously filled in the other project, so there would be a trigger for this PHP trigger to automatically change and then go to the schedules projects to spare that for that individual, meaning nobody else would be able to pick it up. This is available as optional modules on the REDCap screen and under additional customization. That requires programming services because it's an advanced resource, but we're sharing that to show to you how rich REDCap use can be. This is a dashboard for the auxiliary project, the one where we included the schedules. The data chart included filling up the date and time, professional, and this record number would show here. This was a matter of security. That was the participant's number, the participant who selected this schedule, and the availability field would say no. The complete variable, which is a system variable for all data collection charts, the value of that field will establish the color of the dots here on the dashboard. So we use that in order to facilitate dashboard visualization for the free times, the moments which were free and the other ones which had already been taken. So when we open up this page, the red dots shows the times that have been taken and the green ones show the ones that are still available. In the main project, this is a screenshot of how it worked. The first one is the TCLE. We see the checks in the inside the green dots. Once the TCLE is accepted, a person would be then directed to request to schedule a visit by means of that survey line. If this was a no, this would be ended here. And here, on this chart, on the right-hand side, that's a request chart. There's an example of the suspended list with all of the schedules that are available in the other project. As you select this one and save it, we would run a PHP, which would go back to the other project and then change that schedule line and turn it into an unavailable line. So the red dot would appear. The other one is a more recent project, also from the pandemic times. This project includes vaccination with reinforcement doses for the COVID times. Challenge in this project is that we had to recruit 9,000 individuals, considering their primary vaccination schemes. So that led us to 3 different groups of 3,000 people. For those who had been vaccinated with the two vaccines with the 3 types of vaccines. 3 research groups were recruited those people, and given the amount of people we are going to be seeing, they were healthy people who had already been vaccinated. We needed to do vaccination based on a schedule rather than calling them to the project and then crowding the research center. Also, because at that moment, a 3rd dose vaccination was not available to the entire population, it would still abide by an age scheme, and that was a reason for great concern. In addition to that, given the number of people we had, we also wanted the study not to involve paper at all, as telemedicine project was. We also had another issue here, which was the need to collect security information or iatrogenicity by means of a participant's form, which used to be on paper, and we would be optimizing that and transforming that into an electronic file. The study was looking at providing 3rd dose vaccination, which was done on a randomized basis and blindly, with one of the 3 vaccines that had been used before them. Astra, Pfizer, or Janssen. Because of randomization, we use that within the REDCap as well. I'm going to be showing a little more about that soon. Now, the plan is now shown on chart format. That include the 4 REDCap projects to manage all of that. First one, which is this diagram at the top. That was a project where people would go in to make their register of choice, and that would start an online electronic TCLE. If the person accepted that, then the person would be taken to this scheduling screen, a resource which had already been designed for telemedicine. So it was a functional solution, tested and proven solution. So the individual would then schedule their visit. As we saw in the previous slide, that requires an auxiliary project, which is defined here as 4. That would be the different schedules for the visits for different 3 different research centers. So when people accepted on the TCLE and then would schedule themselves, then we would resort to the triggers, the advanced resource of activating a script, and by means a programming language, PHP, we would copy all of the data to the first set of charts to the main project, the big one here. So here, the study steps were then designed. Screening was the pre-filled in data from the fields of interest. There was an in-person visit data. Data would be collected by the nurse or the physician. That would provide for the feasibility of that participant. So now was the time for randomization to find what vaccine would be given to that individual. So the randomization project, we did that as a separate REDCap project as well. We would use the data, we would include the data automatically, so that would not require entering the data and the different projects. So we would copy the data by means of scripting. Once the randomization was done, done on the other project, the data would then come back to the main project on an automatic basis as well. And the process would go on to fill in the chart. So the working team would resort to this project 2 only, and then project 3 for randomization purpose through a specific team.
In terms of resources that we use surveys because the interest in our study, the register of this study was done through an open link available in the internet, with interviews and a lot of divulgence for the request of people to participate. So we have survey distribution tools. We see the open link. It allows to create short links automatically and allows to generate the QR code to access this address. So this QR code we used in the folders that were developed virtually and in paper, distributed in the places where we would go.
Uma vez feito esse cadastro, nesse primeiro projeto, tinha
After
local
done
aqui que a gente validava se essa pessoa era elegível ou não para o estudo, porque como muita gente
the
queria
research, we
vacina,
would know if,
às vezes se
since many
cadastrava,
people
mas
wanted the
não estava
vaccine, we
dentro
wanted to
do
see if the
esquema
person was
primário
eligible
que a
for
gente precisava,
the vaccine, if it was
ou não
within
estava
the
dentro do
primary
período, enfim, tinham duas
requests
fichas
that
que foram
we
feitas para que a gente
would
validasse esse interesse da pessoa,
demand.
e aí sim,
So
se
it
isso
was
aqui
important
estivesse
to
ok, a gente
validate
encaminhava o
the
link
person's
para o
interest, and
DCLE
if it
por
was
e-mail
okay,
de
we
forma
would
automática. Então, o
send
outro recurso que a
the
gente usou aqui foi o de
DSLL link
automated
automatically. So we use the
invitations,
resource of
habilitado para
automated
essas fichas de
invitation
TCLE.
made available by
O
this
recurso de fila de survey a gente também utilizou aqui, e esse
TSL
de form display
forms.
logic,
And
que
we
é
also
uma
use the
regra que
form
você
display
determina para as
logic,
fichas
which is a
ficarem
rule that you
disponíveis
determine
ou
for
não
the
para
forms to be
preenchimento.
available for to
Os
be filled
convites
or not.
automáticos, né, os
The
automated
automated
invitations, permite que a
invitations
gente construa
allowed us
e-mail
to
que pode estar
create
personalizado.
an
Então,
email
por
that can
exemplo, a gente
be
mandava
personalized. So
olá,
here we say, hello,
Margarete Catoia, né?
Margaret
A pessoa preenchia
Catoya,
o seu nome na ficha de
depending on the
interesse, a gente
person
mandava o
of
e-mail com o nome
and
dela
the name that
e
was
um link
registered in the form.
exclusivo para ela
So we
preencher
would
o seu
send with her
TCLE.
name and an
Isso
exclusive
era
link
enviado
for her
quando
to
a gente
fill
via que
her
a ficha
TSL.
de interesse era preenchida, né,
And
de
then the
forma
interest file
completa, o
was
TCLE não estava ainda preenchido e
filled,
alguém tinha validado aquela
the
ficha e visto que estava ok. Então, a
the
regra
TSL
é
was not
colocada
filled
aqui de
yet,
qual é a
so
condição para
the
que esse e-mail
rule
possa ser
is
enviado,
established there. What's
quando
the
ele vai ser
condition for this
enviado, a
email to
gente
be
exame
sent?
de forma
When will
automática.
it be
Então, no momento
sent?
que o profissional
We
já
would
estava aqui remoto e
send it
validava essas
automatically. So when the
informações no
remote
PI,
professional
mandava no
was
REDCap
there
dizendo que estava tudo
and he
ok,
validated all the information in the
no
REDCap
momento que ele
saying it
salva
was
essa
okay,
ficha, esse
by the
e-mail
moment
que é
that he
enviado ao
saves
participante,
this
ele tinha ainda
form, the
lembretes,
email
né?
is
Se a
sent
pessoa
to
não
the participant.
responde
And there
aquele
was also
TCLE
some reminders if the
em
person does not answer that TCLL
num
in
determinado período de tempo, a gente 6 dias depois enviava
in a
novamente e
certain
fazia
period
essa
of
repetição por
time,
3 vezes,
we
né?
would
A ideia
send
aqui
it
foi
again
de
6 days
6
later,
dias,
and we
porque
would
se
do
ela
it
recebeu o
this
e-mail
after
hoje numa quinta-feira e ela não
this one time. We would
responde,
do it
quando for no
again
quarto ou
because the
semana
idea
que
is
vem,
that
ela recebe
if
novamente um
this
link, depois desse da
receives
semana
this
que
on
vem,
a
ela recebe
Thursday, she would
novamente
get
um link.
another link on Wednesday if she doesn't
Isso aqui,
answer it.
então, para vocês terem noção do tamanho,
So
foi
here,
esse
just so you
estudo.
have an
Então, foi
idea of the
projeto
size
que
of this study,
também,
it was a
dentro do
project
REDCap, ele
that
foi habilitado como um
within the
projeto
REDCap
de
was
banco de dados
habilitated as
longitudinal, porque
a
era um projeto que tinha várias
database project,
visitas. Isso
longitudinal
faz com que o banco de dados do
database,
projeto
because it
tenha
had a lot of visits.
ele
And
não
this allows
funciona
the
como
database
uma
for this
simples
project
planilha de
to not
participantes em
work only
linhas
as a simple
e variáveis
participant
em
sheet
colunas,
in lines and variables
mas
in
isso não
columns,
é
but
um problema
this is
para
not
quem
a
fazer
problem
análise de dados, tem que saber
for those who
trabalhar com
do
com
data
essa
analysis.
questão
You
de
have to
eventos.
know how to
Então, a gente
work with
tinha
these
22
events.
eventos desenhados
So
e
we had
38
22
fichas
events designed in 38
construídas para
forms
atender esses 22 eventos. Aqui é o painel
to
que
attend
mostra as
this
fichas que são
22 events. This
preenchidas
is the panel that
em
shows
cada
the
momento do estudo, né, em
forms
cada
that were
evento.
filled for each moment of the
E
study, for each event,
os questionários eletrônicos que precisavam
and
ser
electronic
respondidos
questionnaires that
para
needed
dar
to be
conta do
answered
diário do participante
so
eram
that you
links que eram
could deal
enviados
with
para
the
os
participant
participantes diariamente
diary.
durante as 2 primeiras
It was
semanas. A
sent to the
gente
participants
fez
daily during the first weeks.
uso, então, olhando aqui para o
So we
projeto
used,
principal, né? No primeiro
looking at the
bloco
main
de
project,
eventos de
in the first
triagem,
block
eram os
of
dados que foram
triage
importados
event, we
do
have
projeto de cadastro
the
de
data that was
interesse através
imported through
de
the
PHP em
interest
script e usando
forms
o
through
módulo de
PHP
API
script
para
and using
importação
the
de
API
dados.
model for importing
O bloco aqui
data.
da visita 1, a gente
The
tinha as
block
fichas que
for
eram
visit one,
preenchidas
you had
on-site
the files that were
pela
filled
equipe do estudo,
on
né?
forms and filled on site with the person being on site, being present, because it was a physical feeling, because it's a need that SAPI has. Then presential evaluation, the randomization form was filled automatically here, the vaccines data collection, and the three forms of blood samples that was in blank, and then the blood was sent to the lab. And when the lab processes this, it would send a CVS file for us with the results using a label with the participants number. So we had this number and result, and we would use the tool for important data, the one that is on the left menu, that is very simple, so that we could import data directly to the REDCap files, avoiding this way that we could have any kind of errors, mitigating errors through typing. And you can see these last three columns, you have check on the green circles. That was the questionnaire that was answered by the participants, and the link of these questionnaires were sent directly through SMS or email. They were surveys that had automated file sent. We did a partnership with Twilio, which is an integrated service that is integrated natively with REDCap, because the SMS message has a cost to be sent. So the email, we thought that might not be a service that would work properly, so we do it through SMS as well. This is available at the additional module. And besides this additional module, we used the resource of repetitive instruments, so files that can be, forms that can be filed more than once. Example that I'm showing here, contacts with participants. You would call someone to schedule it or anything else, you have to fill this form. If you have to call it again, you have to fill the form again, and that's possible. That's why we have the plus sign right next to the green circle. And we also enable the use of email to send the links. We have an example of a form that is not available because of the form display logic. There is a condition there. For example, if the person does not do the blood collection, the blood sample, the results were not enabled. So we would avoid wrong fillings of the forms. So we have the randomization module with as an additional module, and that makes so that in a randomization module, you can see a button there where you can click the randomization chart outside of the REDCap, but the button can access this sheet and show which vaccine should be applied. The last resource that I wanted to present is the use of dashboards for the project. It's a more recent project. And here we can build panels that see or exhibit data from the own project in a graphic way or in the form of a sheet. And these panels can also be shown as public. So if you know Power BI, it's a software that does dynamic panels using database, and here in REDCap we have that. So we had a panorama, an idea, a view of the vaccines with graphics in bars and in circles, and every time it was accessed, it would look at the data in real time. That's what I wanted to present. Thank you very much. Thank you, Margaret, for your presentation, for the examples that you brought. Very interesting examples, very important for us here. Before passing the floor to Ana Paula, I wanted to recognize that we have some technical problems with translation, and we will leave this video available. And in the moments of the videos that we had technical problems, we will correct for those who will have access to the recording. I just wanted to remind you of that. And I welcome Ana Paula. Ana Paula is graduated in nutrition for the Federal University of Rio de Janeiro. And is a specialist in quantitative methods in health for Sejaroca National School of Public Health, and has a postdoc in the group of research for obstetric epidemiology of the National Institute of Research and Medical Health, the INSERT, in Paris, France. Currently, she works collaboration with Fiocruz, Unicamp, and INSERT from Paris, studying the determinant of health for mortality and maternal diseases involving children. And Ana Paula is with us here, and I just want to remind you that we have 15 minutes for the presentations. Yes, good afternoon to everyone. So it was very interesting, Margaret's presentation, because I learned things that I didn't know. There are always news about the SMS is something different for us, but we've only been doing this through email. So that's important that these webinars allow us to learn more and more. We from Growth in Brazil, we use REDCap for different objectives, for different needs, in terms of low budgets. And before commenting about these studies, I'm going to do an overview on this study because it's a study of high complexity, and it's important for you to understand all these nuances and how we've used it to aid on the data collection. So Birth in Brazil, it's a national research for women and babies, and with aligned studies following women, with the research also with the health professionals, the research on hospital infrastructure, and also we have evaluation of fathers' mental health. Within the hospital phase, we have interview, we collect data with the medical sheets, and we have the segment during these 4 months with all the analysis, diseases, and informations. And we have a qualitative interview with women related to the professional studies. We have nurses, physicians, psychologists. This part of the research was also done by researchers through QR codes with field forms so that they could fill this section. The research on hospital infrastructure is amplified to focus points with directors. And the father's mental health, especially the PTSD. And related to the aligned studies, we have a very comprehensive study with prenatal studies and prenatal mortality and big structured hospitals. We have 480 hospitals in Brazil, and we had about 208 that joined this project. And I study about maternal deaths related to this subject. within maternal mortality with the DERB certification that we included as data. So the Birth Brazil study, as I said, has 418 hospitals participating across 27 states, all the 27 states of the country. We have an estimation of collecting through 21,800 women, and we have used REDCap because of our management need, people's management, and this huge participation of data collection, health professionals, and all this studied through team management. And we also use REDCap to do this team management, as I said, hospitals participation, and to do team training on data collection. Now, when talking about management, team management, we've developed 3 projects. One project that is specific for enrollment and selection. So we have forms from them to register. And after this selection, we create a specific project for a unique registration and a specific project for the production of data from this team. We have currently more than 1,500 people registered in this unique record, unique registration. Some people that has shown interest in the project through supervising. All this team is registered in the form that aggregates all this information, participation, period of participation, and in these 3 different instruments.
Concerning users, those are the people who have access to the central team team, and people who have access to the teams so they could actually collect the necessary information to liaise with participants and all of that, and sign certificates and so on and so forth. And hospital management of the participants' hospitals, we developed 2 projects, 2 research projects. One was for registering those hospitals in the REDCap, and the other one was to manage the field work that was done in the hospitals. So we have 3 different data collection tools, and we also have the forms to keep track of data collection through the REDCap. And this project includes 100 users and more than 600 records, because it's not only the participating hospitals, but also the other ones who were in the initial stages are included. Now, when it comes to the scope of training teams, we also had to create different projects, because different teams would be working at different steps, at specific steps of the project. Some teams would be collecting interviews, other teams would be collecting the prenatal charts and others, and the other teams that do the follow-up for the women. So we had to separate the different projects, not only for collection purpose, but also to train them in the specific project they'd be working with. Within these training projects, we also had to create different instruments. I'm not going to be listing them here because there are way too many, but we did include nearly 700 people, and they did have the forms filled in, and that adds up to nearly 3,000 forms for data collection. Most of our collection and this study was done online, so it was done in the hospitals with health professionals. I'm sorry, her connection is being disconnected. It's being chopped up. I cannot hear everything she's saying now. In terms of online collection, 4 or 5 projects, 22 instruments, coming close to 700 users and 30,000 records, more than 30,000 records. We also used offline data collection in regions where internet connectivity is a bit more restricted, or medical records are collected in a local household file in hospitals where there's no telephone connectivity, let alone internet connectivity. So in these cases, would be using the same data instrument. Should be using the mobile app, which is previously downloaded, so the team is trained to use that. The offline collection is a bit more complex in the beginning, so that people become acquainted with systems and facilities. And we use that for interviews and mostly for medical records. So we had to separate them. We had to separate them because of conflicts, because instruments are used by different people. So we would then have to bring all that to an online project when we had connectivity. So we have a total of 8 instruments. At the maternity, the project is all conducted online because it involves filling in or collecting data from online files that are a simplified version of the offline collection process. That adds up to nearly 70,000 records, because in that study, we went to those hospitals for an entire month to collect all of the obstetrical information. And we do a screening in order to check some maternity conditions. And because of that, we had to use this REDCap tool, which provides for project organization. There are many projects, there are many forms in each project. So we created this different files, so we could fit the projects inside each thematic folder. So these ones are related to team management, and also one project that includes all of the hospital information that involves many instruments. There's 6 inquiries, but they're all grouped under a single project. There's also the training projects, which were done in separate as well. So there are many different data for each of those projects. We also had the data collections projects. We separate online and offline collection in order to make life easier for the central team, where they have to go in to collect offline data and do the uploading process. So we used it in a way that would make the job easier, which is a rather complex and labor-intensive stage of the project. We also had the offline project, the MMG triage, and mother mortality data. That's done by the central team, and based on that collection of data and the hospitals, we have duplicated the project, and we prepare specific forms to certify them for certification by our central team. So a lot was mentioned by Margaret. Many of those tools that you mentioned are also used by us. Some of them are novelties, the ones that I've learned, and others that I'll be able to share with you. Some practical examples concerning team management. We use a lot of data import, automated survey invitation. I'm going to give you an example, and then survey login. Somebody asked about it. And also data storage and sharing. Margaret has already showed that to you, but we create records before we include them in a single record. So we collect basic information, name, email, and taxpayers' individual numbers. So we select the data from those people who were selected for the research. And then we use what we refer to as survey invitation. Survey invitation and the single record is actually used twice. First, to invite the selected participants to complete their forms, which is rather extensive. That involves a lot of different information, participation in the project and the period, and residential confirmation documents that will help manage payment abroad, and also the second invitation, which is sent on a monthly basis according to the person's production in the project. So we use this trigger whenever there's a production made available through the link. So the person would go in, would enter, would log in, and then authorize that. So we have 300 to 400 people receiving that. Those numbers have come down a bit, but we came close to 400 people to do payment management, which is done, as we said before, by production. So we needed to factor all of that in, and we used this resource. This is an example. A question was asked about data protection. So what do we do in order to avoid access to that? So we use a person's individual taxpayer number, and that is the only way an individual can access that survey, so that the person can complete the records, because there's sensitive information in that. And then later on, for us to check the person's production in that month. Later on, we can include other information so that access is even more restricted. So we can include, in addition to the individual taxpayer number, we can use date of birth and all of the information that people have to fill in so that the person has access to that information. Just an example of some of the documents that we share. The authorization, terms of authorization, they download it from the REDCap, and then they upload it, the documents once they are signed, and also the certificates we share with them. Some of the fields also include action markers. They're called hidden fields.
Alguns campos que a gente é de preenchimento somente da coordenação, que a gente quer que eles vejam, mas que não possam alterar. Então, a gente usa, por exemplo, read-only field, read-only survey. Existem diversos marcadores de ações que a gente usa.
We have many action markers which are used to help us handle all those instruments. When it comes to participating hospitals, we use similar invitation tools for invitation to the hospitals which are selected. Data storage and sharing, also field reports for data collection in the different hospitals, and we also use the dashboard in the REDCap, as well as external one, as we have mentioned. We also use the standardized invitation with a little letter to the director. When that is sent, that's when we share all the information. This was done before the research in the hospitals. We send that to the directors, and we send that also to the people so they can fill the different forms at the hospital level, which are the so-called focal points, which can provide a lot of important information so we can plan teams access to the hospital. Access to that in the hospitals. These are examples of calculated variables. We try and separate some of the forms that use these calculated variables. There's a specific form, for instance, with all of the estimates that we calculated prior to entering the field. And supervisors or central coordinators, they will have access to those estimates, to those forms, which are then done after the surveys are filled in. The focal point surveys are filled in. Based on those surveys, they calculate those variables, help us estimate different numbers and different information that's going to be helpful in the planning process after field follow-up. Here, same thing, use of documents, terms of consent, executive summary, and the approvals, they have access to all of that. They can download that. And because of the volume of data, and this is an example of the field reports in the project of hospital information. That's information, aggregate information at the hospital level. We also need to get all of those reports organized according to the objective. The purpose is to store sample information or estimates or field work of the hospitals that have been included. All of that will be helpful for our follow-up. We have different flows and the reports, so that's our team that does field follow-up. They can to facilitate their work. We also use weekly reports, monthly reports, but I cannot show everything to you because it's a whole lot of data. But we have that. The quick example of dashboards, they are rather simple, but they're also very helpful to provide quick visualization. We can do that very fast in chart format or table format. The information is requested, and then we can have a quick look at these dashboards and provide that. That also includes the public links for those who are willing to take a look at it. You can also use HTML language. We're working to reduce the need for these elements here because it will be easier. The novelty I'm going to be presenting, which was not presented by Margaret, is the team training. When we come to that, we use this tool, which is called data comparison tool, because they used to fill up the medical chart forms, and we had templates to correct that. There are many people enrolled to that, and REDCap has been very helpful in correcting that in order to enable people for data collection. So we use this tool, for instance, in this mobility study. That's how we did it. We included the 3 different templates, and we blocked the records to avoid changes. And each of these lines are cases which are filled in by the participant. And we use that tool, data comparison tool, to help identify all of the cases, all of the issues that were disagreeing with the templates that would make it easier for us to deliver what the people wrote in and to include them in data collection.
In the case of maternal mortality, the certification of these cases we did in a different way. Since it was 6 cases, we decided to use the survey 2, in which we, as explained before by Margaret, we can organize this filling. So we have one case after the other, and we had only one record per student. We only had we use the same tool for data comparison, and we would compare with the right answers for the test of the cases that people filled. In the data collection that we did basically online, we had a very important resource because of the amount of data, which was the division of the teams by data access groups, so that we could have the REDCap functioning in a faster way. So we have this division of data access, we run faster, and because of the data production with the state coordinators, they could have access about the data only that they needed for their team, not having access to other teams. All this auto-validation, branching logic that was mentioned here, we did a lot, calculated variables of high complexity, a lot of field reports. live
e
filters,
painéis personalizados e dash.
personalized
Então, aqui é um
panels, and
exemplo
dashboards.
do
Here's the
Data Access
example
Groups,
of the
onde
data
temos
access
a
groups,
divisão dos usuários
showing
dentro do sistema
each
de
one of the
acesso de
27
dados.
states of Brazil
Então, foram
in the
100
data
acessados.
access.
No estado de São Paulo, a gente divide
127 states. In the state of São Paulo, it's divided in 3 groups because of the size. So, and it's also possible to make this kind of division. And here we have some calculated variables, example, and action markers that we use frequently. And since there were many forms, we needed sometimes to have, for example, the form of a follow-up of 2 to 3 months. And we would get it from the hospital, get the information from the code, the woman, and we could use it, her cell phone, and send her link in a form. So the scheduling and which dates we would expect for the interviews to be carried on. In this case, we didn't use the 2 to 4 months follow-up interviews. We didn't use the automated survey. We used the division by teams, by form, and that worked out pretty well because we knew that we had that option of SMS, but we didn't know that right at the beginning. So we would do it with the interviewer that would copy the link directly to the WhatsApp of the participants in the case that they didn't want to do the interview by phone. And the call text, which is an action marker, it's a variable, it's calculated, but it's an action marker with variable. And we use a lot these links to instrument filled in by the service. So we would have the follow-up interviews with inside the reports so that the study group could organize and copy directly without getting into each one of the forms. They could visualize all these links in the report. Here's the application of custom filters to visualize these panels. Since we have many forms, so that we could make this visualization of data collection, we would use a lot of these filters in the panels for the selection and the ones that were refused and the ones that we needed to personalize, in fact, to fill in the forms. As said before, the green ones are the ones that are completed. And when there is a check like that, it's was through telephone. So the follow-up for the mother, 2 to 4 months for the pregnant woman. And the white ones is the ones that we didn't have the data from the pregnant notebook. And another example of dashboard that we saw in the Birth Brazil is the follow-up of registration, the percentage of abortion, and a general framework that we can use to point out by state, and the use of the API Playground that was done to the Birth Brazil 2, so that we can visualize. Here have the data. We used Python. We got the data. We created reports within the REDCap with variables that would be necessary to generate this visualization and dashboard through API token. And the RShiny would do or does this visualization of data. In our case, we had the interest of the intention of visualizing the interviews within each hospitals and within the states, and that made us possible to do it each
que já
hospital
tive
and each
alguns
state.
indicadores,
We
resumos
see here
de
some
tudo do
indicators
estado e dos hospitais, então o
summarizing the
estado do Acre,
states
por
and the
exemplo, quantos
hospitals. Here's
hospitais,
the
quantos
state of
diagnosticados,
Acre, how
quantos
many
terminaram, e
hospitals,
aqui cada linha
how many began, how
o
many
andamento do campo
completed,
nesses três
and the
hospitais,
follow-up
Brasil
on the
e o
fields
Acre.
of
E a
these three
visualização
hospitals
aqui
that are there as an
é como
example.
foi esse
And we
andamento
have a visualization of how
das
was the
semanas de
follow-up
trabalho de campo.
on the weeks that we worked on the field.
Para não me alongar mais, acho que já falei
I don't want
bastante,
to
porque o tempo também,
talk any
e
further. I
aí
think that
aqui
I've
perguntas, e
been
muito obrigada
talking for
pelo
quite a few
convite.
minutes now, but I'm open to questions and thank you very much.
Isso.
Muito obrigada, Ana. Outra
Thank you,
experiência
Ana.
riquíssima, né, que a
Another
gente
very
tá
rich
mostrando aqui,
experience that we
né,
are
para
showing
os
here
nossos ouvintes, não, dos participantes,
to our
com como está
listeners,
com
to the
avançar do
participants.
tempo, eu ia
Since
pedir para
that
os
we don't have
palestrantes
too much time,
começarem também a responder,
I would ask
né, lá a
the
sessão de
participants to
perguntas e
begin answering the
respostas,
questions
porque
as
tem
well,
muitas perguntas e
because we
respostas e a
have
gente
too many
não vai
questions
ter como a
here,
gente
and I don't
respondê-las,
think
né,
we'll be able
oralmente
to
aqui para
answer
todas. Então, a gente
all of
ia
them.
pedir para que vocês, palestrantes, já
So
começassem a
right here,
responder
so maybe
as
we
perguntas
would
que estão
ask
lá.
you to
Então,
answer the
obrigada, Ana
questions in the
Paula. E
chat
agora eu queria
so
dar
that we have that
boas-vindas
opportunity.
ao André Basto.
And I want to
O André, ele é
say
graduado em
welcome
medicina pela
to
Universidade
André
Federal Fluminense,
Basto Daher.
residência em
He's
infectologia,
has a residence
especialização em pesquisa
in
clínica no
infectology
Hospital
and
Alemão Oswaldo
clinical
Cruz
research
e
by the
doutorado pela Liberty
German
School
hospital
of
Oswaldo
Tropical
Cruz,
Medicine.
and has a doctor
Atualmente é coordenador da
by
plataforma de
Procom
pesquisa
Medicine.
clínica
He is
da
the coordinator of
Fiocruz,
the
na
Fiocruz Clinical
vice-presidência de pesquisa
Research
e
platform
coleções
in the
biológicas
Vice
e faz
Presidency of
parte da
Research and
coordenação
Biological
da rede
Collections,
de pesquisa
and is
clínica da
part of
Fiocruz,
the
da rede de
network
biobanco da
of
Fiocruz.
public
É
research
membro
of
do
Fiocruz.
Comitê Científico
He's a member of the
Consultivo
scientific
da
committee, consultant
DNDI,
scientific committee of
Iniciativa
the
de Medicamentos para
DNDI,
Doenças
the initiative
Negligenciadas.
of
Experiência
neglected
na área de
diseases.
medicina com ênfase
Has an
em doenças
experience in the
infecciosas e
medicine area with
parasitárias,
infectious
atuando
disease and
principalmente nos seguintes temas: desenvolvimento
parasites
tecnológico de
diseases,
medicamentos e pesquisa clínica. É
and
o pesquisador principal
is
do
the
projeto
main
Sakura, e ele vai
research
contar
of
um
the
pouco para a
Sakura
gente.
Project, which he'll talk a
Então, a
little bit
palavra está com
about.
você, André.
So I pass the floor to you, Andre.
Olá, bom dia a todo mundo. Eu não
Good
tenho
morning to
apresentação, eu
everyone.
vou
I
tentar
don't
ser
have
breve para
a
a gente ter tempo.
presentation,
Primeiro,
but I'm
queria
going to try to
agradecer o
be
convite,
brief. First of all, I'd like to
dizer o
thank
prazer que é
for the
fazer
invitation and
seminário para tanta
tell you
gente no
how
mundo, né? Seminário
much of a pleasure it is to
falando em
do
português.
a
Eu acho que é a
webinar,
primeira vez
international
na minha
webinar,
vida que eu
speaking in
faço isso
Portuguese for
e isso é
people
ótimo,
all over the
porque
world. And I think it's great because
a barreira da língua é, de
the
fato,
barrier of the
importante. A gente
language
sempre foi
is in
mais
fact
besta por estar
important.
falando outra
We
língua.
always sound a little bit
Agora não tem
more
desculpa.
cocky when we
Mas, de
are
qualquer
speaking
forma,
a different language, and now
então,
I
acho
don't
que a
have any
barreira
excuses.
da língua é uma coisa
So
importante. E o que a gente
I
está
think the
falando aqui também são
language
de
barrier
soluções
is
que são
something
soluções de ciência
important,
aberta.
but I
Então,
think we're
como eu
talking
não trouxe
about
uma
open
apresentação,
scientific
porque
solutions. I didn't bring a
tem
presentation
uma...
because I
Ops, apareceu alguma coisa aqui para mim.
something showed up here. Let me see.
Então,
So
tem uma solução que eu vou apresentar
there is
aqui,
a solution
mas
that
é
I'm
uma
going to
solução
present. It's
de
a
código aberto
open
para
code
monitoria
solution
central de estudos,
to central
e isso
monitoring
foi
for studies.
publicado
And
recentemente
this was
no PLOS
published
ONE, num
recently in the
paper que
Plus
chama
One, in a
A Code
paper
for
that is
Clinical
called
Trials
A Code for
Centralized Monitoring,
Trials Centralizing Monitoring,
Sharing Open Science Solutions to High Quality Data. Então, código para monitoria
a
central de ensaios
code
clínicos,
for central monitoring
uma
for
solução para monitorar a
clinical
qualidade dos dados. Então, eu vou falar aqui da aplicação de um exemplo
research.
real e de um exemplo
So I'm
de
going
uma
to talk
realidade
about a
que é
real
o
case here.
exemplo original do REDCap,
It's
né, que
an
são os ensaios
original
clínicos.
example from
Então, nesse ponto, a
REDCap,
gente
the
não é muito
clinical
original, mas, por outro
researches.
lado, as soluções que são apresentadas
And
são
the
soluções que foram
solutions
debatidas
are
antes.
solutions
Para
that
falar a
were
verdade,
debated.
esse artigo
To be
tem uma
true,
parceria
to be honest,
tanto da
this
Margarete
article
quanto
has
do
the
Leandro
partnership of
Amparo,
Margaret
que
and
foram
Leandro
fundamentais
Amparo.
para a elaboração
They were
desse
key
estudo.
elements for
E
the
é um
elaboration
estudo,
of this
então,
study.
desse que eu vou
And
falar,
it's an
um estudo
essay, a
randomizado,
study that is
ensaio
randomized,
clínico randomizado duplo cego.
a clinical
Então,
essay randomized.
esse estudo, então, ele usa
This
4
study
bancos do
uses
REDCap,
4
vou falar um pouquinho da
data
metodologia dos
bases
problemas que a
from
gente
REDCap. I want to talk a little bit about the methodology and the problems that we faced
Então, o
to
primeiro banco é um banco de
solve it.
recrutamento,
The first
né, em que a gente tem os
data
falhos
bank is
frequentes.
a recruitment
Para
data
quem é dos
bank, and we
ensaios
have
clínicos, a gente sabe
the
que é sempre
failures of
importante a
this
gente
area, and we know
relatar
those who are from
as falhas
clinical
que ocorreram
assays that
para
it's
evitar
important
viés de seleção.
that we should
Então, quando você
avoid
vai relatar um ensaio clínico,
recruitment
publicar um ensaio
problems
clínico, você
to
publica
avoid
ele de
repetition.
acordo com consorte.
So
Que é um
we
diagrama que justamente
publish it
diz,
according
olha,
to
eu
consort, which is a
tive
diagram that
tantos
says that,
pacientes, eu não
look,
incluí
I had
eles, o
this
que eu não incluí
X
foi por
number of
azar.
patients and I didn't include
Então, esse é
them
o
for
primeiro
this or
banco.
that reason.
Se
So
ele é
that's the first
elegível,
data bank.
então ele vai ser
If
randomizado, porque é um ensaio
it is
clínico
eligible,
randomizado,
it
né?
will be randomized because it's
Randomizado o
a
quê? Ele vai
randomized
ser
essay or
alocado,
rehearsal
seja no braço placebo ou no
because it's going to be
braço
allocated on the
de tratamento teste,
placebo arm
né?
or the
Mas esse estudo traz
test
trouxe
treatment arm.
uma
But
complexidade
this study
especial.
brought
Por
a
quê?
special
Porque ele era um estudo
complexity because
de recrutamento
it's a
competitivo,
study of
que aconteceu
competitive
durante a
recruitment. It
pandemia.
happened during
Isso quer
the
dizer, a gente
pandemic.
não tinha um número
That
definido
means that we
de
didn't
quantos
have
pacientes iam ser
a
incluídos em
definite
cada
number
hospital.
of how many
Pelo
patients
contrário,
would
a
be
gente
included
foi
in each
abrindo
hospital.
hospitais ao
On
longo
the
do
contrary,
estudo.
we began
A gente fez
opening
estudos de
hospitals
monitoria de
during the
iniciação
study. We
e
did
logo em
some
seguida abriu os sites.
monitoring clinical for
Então,
initializing, and then
um estudo
we would open
competitivo,
on
ele
website.
traz esse problema que a
And a
lista de
competitive
randomização tem que ser
study brings
central.
this problem because the
Então, eu tenho
randomized
como
list has
alocar
to
um
be
determinado número
centralized
de
because I
tratamentos em
cannot
cada lugar,
allocate a determined
né?
number of
Como ele é do
treatments to a
placebo,
determinate
os
place.
frascos vinham com
Since it was a
números.
placebo,
Então, a gente tinha uma
the
realidade da fábrica, né?
capsules would
Então, a
come
gente tinha uma
with
realidade,
numbers.
tanto para o
That's the
paciente quanto
reality
para o
of the
médico não
fabric,
saberem o que estava sendo dado.
so that the
Então,
patients
na
and
realidade,
the
a gente se
doctors
viu
don't
diante desse
know what
problema.
was
Como é que
given
a
in that
gente faz
capsules.
estudo randomizado,
So
competitivo,
we
os
had this
frascos,
problem on how to do in a
fazer os
randomized
frascos
competitive
chegarem lá a tempo.
rehearsal
A
and
solução
making that
vem de um
capsules
produto
arrive in time.
farmacêutico não
The
celo.
solution comes through
Então, a gente
a
recebe
non-blind
de lá
pharmaceutical.
duas caixas, né, no hospital,
We have two
frascos.
boxes in the hospital with the
A gente sabe, o
capsules.
farmacêutico sabe o que é placebo, o que não é
The
teste, mas
pharmaceutical
o pior que
knows
podia acontecer
which
é o
is, the
farmacêutico
pharmacologist
simplesmente dar
knows
um número, errar a
which one
caixa
is
e dar para o paciente
placebo, which one
o
is not.
teste no lugar do
But
placebo,
a
e isso
problem could be of like
enviesaria
uh,
também o resultado do estudo.
handing the
Então
wrong
fez-se outro
box
banco,
to the
que é um
patient,
banco
and that
de
would
controle de frascos.
become a problem. So we did
Então, nesse banco de controle
another
de
control
frascos,
of
o
the
farmacêutico não cego tira
control of
lá
the
da
bottles.
caixinha e
So the
escreve um número no
pharmacologist
formulário. Esse
takes
formulário
it
precisa
out of the
então ser checado
box
com
and
outro
writes
lista,
down in a
né? E
form,
essa
the number in the
lista,
form, and this is checked with
se não
a
tiver nessa
list.
lista de frascos,
And if it's not in the
então
list of bottles,
esse número não é aceito. E se
this
estiver
number
nessa
is
lista,
not
esse
accepted.
número
And if
nunca
it is in
mais
this
vai ser
list,
usado. Esse foi um recurso que
it might
Margaret
not be used.
apresentou,
That's the
né?
resource that Margaret
E aí, então, a gente passa
showed
para o
us here.
banco
And then we
central, que
go
são
to the
com os dados
central bank,
clínicos. A
which
Margaret
are
mostrou
the bank that
logo
has
no
the
início,
clinical data. Margaret
de
showed an
como
example
esses
right at the
bancos,
beginning
então,
of
são
how
constituídos,
these
o
banks are
exame físico,
constituted
exames
in terms of
laboratoriais,
physical exams, lab exams.
né? É importante dizer que
It's
todos esses
important to
bancos
say
se
that
linkam
all these
através
banks are
de rotinas
linked
automatizadas
through
sincrônicas que
automized
fazem com que o link no ID primário do paciente não
routines
se
and
perca
synchronized
entre os
so
bancos,
that the
garantindo assim
patient's
uma
data
rastreabilidade.
won't get lost,
E por fim, a
guaranteeing
gente tem
the trackability of
outro
it.
banco, que era o banco do diário
And we
do
have another
paciente,
bank,
que é um
which
banco
was the
acessível
patient's
via celular,
diary,
com envio de
assessed
SMS,
through
survey,
mobile,
como
by foi
SMS,
falado
aqui.
in a
Então,
survey, as
essa
was said
estrutura está
before here.
descrita nesse
So this
paper,
structure
esse
is
paper que eu
written in
falei para
this
vocês,
paper that I
mas
mentioned.
esse paper, uma
But
outra
this
solução que eu queria
paper,
trazer aqui,
another solution that I wanted to
uma
bring here
solução
is
que
that
vai além disso, né?
it goes
É
beyond
uma
this.
ferramenta para
It's a
monitoria
tool
central.
to central monitoring.
Então, essa ferramenta
So
fala
this
bem com
tool
essa última palestra da colega,
speaks
que
well
falou do uso do
to
Shine.
what the colleague
Nada mais
said
é
about the
que o fluxo de
Shiny, the use of Shiny.
que
It's
acessa
nothing more than
via
a
uma
Shiny
API
script
o seu banco de
accessed
dados
through an
REDCap
API,
e gera
your data bank
dashboards,
in the REDCap and generates a
né? Mas
dashboard.
o que é isso
But
conceitualmente,
what does
né?
that
Então,
mean
assim, ensino médio,
conceptually?
os colegas já explicaram isso melhor.
As the doctor
Esses
said,
códigos estão disponíveis no Arcadados.
it's
Você
available
busca,
in
então,
the ARC database
mediante requisição, né? Então, vocês podem pedir esses
as
códigos.
requested.
Eu
You
vou
can
conversar
ask
com
for
Margarete e
those
Fernando para ter
codes.
acesso, e
You can
Leandro para ter
talk
acesso a
to
eles.
Margaret and Leandro to have
Mas,
access.
basicamente, então,
But
o que que esse código faz? Esse código é
basically,
chave.
what this
Ele
code
acessa
does
o
is
seu banco de dados
it
e
accesses
faz
your
uma monitoria
database
central, né?
and does a central
As práticas
monitoring.
clínicas, elas são as mesmas desde
Both clinical
1986, agora a gente,
tests are
96,
the
agora a gente
same
está numa
since
revisão.
1996. We're now
Naquele
reviewing
tempo era
them.
tudo feito em papel, né? Hoje em dia a
When it
gente
was
não,
done
né,
in
usa
paper,
leitura eletrônica de dados,
now we
mas
use the
continua
electronic
ainda
capturing of data,
avaliando os
but we still
dados
evaluate
em campo,
field
né?
data.
Quer dizer, você tem um monitor que vai lá e checa
You
a
have
veracidade
a
do
monitor
dado no
that will check the
hospital,
veracity of the
olhando
data
para o
in the
REDCap.
hospital,
A gente pode
looking
fazer
at the
isso
REDCap.
centralmente.
We
Isso é
can do
parte de
this
uma abordagem que tem
centrally. This is
sido
part of an approach
reconhecida
that
como
has been
importante,
recognized as
inclusive na última
important
revisão, a
uh,
R3
in the
agora,
last
do
R3
ICH,
reviewing of the
Relacionado às Práticas
ICH
Clínicas,
of good
que fala
practices, of
da
best
monitoria
practices
baseada em
in
risco.
terms of clinical
Isso quer
practices.
dizer,
It talks
eu
about
não preciso mais verificar
the
tudo de novo.
variable in monitoring.
Eu
That is,
posso
I don't have to
centralmente
verify
ver os
all
campos mais
documents. I can
importantes
centrally
e
look
ver
at
se
the
esses campos
main fields and see if
estão sendo, enfim,
these
preenchidos
fields are
adequadamente, de forma que eu garanta, então, a
being
robustez
filled
do estudo. É
properly so
claro
that
que
I
no
can
exercício de estudo a
guarantee
gente
how
precisa
robust the study can be.
ir,
Of course, that
sim, ao
in
hospital,
all
a gente
studies,
precisa
we need to
de
go
fazer
to
monitoria
hospitals
durante todo o estudo.
and do the
No
monitoring throughout the whole
princípio, é
study,
converter 100% dos
eventually
dados,
100% of
longe
data,
para
so
evitar.
that we can avoid.
Não tem apresentação.
No,
Para
there's
evitar,
no
então,
presentation. I'm answering someone in the
para
chat.
evitar,
So to
então, erros
avoid
sistemáticos, mas de fato,
systematic mistakes,
a gente
but in fact,
pode, ao longo
we
do estudo,
can,
reduzir o número de campos
throughout the study,
verificados.
reduce the number of
Mas
fields that
para
we
isso, a
evaluate.
gente
But
também precisa
for
dessa
that,
ferramenta,
we
que é uma
need this
ferramenta de
tool,
monitoria
which
central,
is a
uma
central
ferramenta que eu
monitoring tool,
consiga
a
ver
monitor, a
todos
tool
os
that
dados,
can allow
com
us to
alguma outra
evaluate the
desvantagem.
complexity
Por
of
exemplo,
data
não
with
posso
some other
avaliar a
advantages,
performance
such as
desse centro.
performance,
Dizer, um
for
centro que está
example.
repletando
That
muito
is to
pouco,
say,
ou
a center
centro
that is
que está repletando muito,
reporting
que
very
pode ser
little
um
or
sinal de alerta.
reporting too much,
Eu
which can
também
be
posso
an
olhar,
alert
por exemplo, da
symptom.
completude dos dados,
I can see
né?
the
Quer
complexity of
dizer,
the
há muitos campos
data. That
faltantes.
is,
E
there
com
are
isso eu
many
posso gerar
fields that
relatório
are
para falar para o centro,
not
olha, esses campos
filled,
estão faltantes.
and I
Os desvios
can
de protocolos
report on that. The deviation
são
on
justamente
protocols
quando você tem, por exemplo,
are
pacientes que não
also, for
atendem
example,
as
when you have
demandas
patients that do
especificadas,
not
né,
answer
de
to
datas
specific
para realização
windows
de
of
exames ou visitas,
dates for
isso também
exams,
pode ser checado
that can
nesses
be
scripts de
checked
R que já
in the scripts
pré-delimitam quais são as
that
visitas,
can
e aí aparece para você no
delimit
final
which
para
are the
você entrar em
visits,
contato
and
com o centro. Então, isso é interessante de dizer. Esse
this
script
is
de R,
interesting to
ele
say. This
nunca vai acessar o banco
script
e alterar
will
o banco.
never
Por que
access
isso? Porque a
the
gente quer garantir
database and
a
alter it. Why is that?
rastreabilidade
Because we want to guarantee
dessas
the
alterações, e
trackability
para isso
of these
a gente
actions,
precisa
and for that
do
we need
audit log do
the
REDCap.
audit
É uma
log
ferramenta
of the
muito
REDCap,
importante,
which is a
porque
very
aparece
important
lá
tool,
quem foi
and
logado,
shows there who
em que
logged
nível que tinha de acesso,
and
para
to
saber
what
se ele
level of
pode ou
access
não
they
alterar os
had, to
dados.
see if they can or not access data.
Por fim, então,
Lastly,
esses dados foi apresentado
these
que
data,
o REDCap
which are
pode fazer esses
presented here,
relatórios, ele de fato faz,
REDCap can
mas
do those
esses
reports.
scripts do
It
R, ele
indeed does
permite
them, but this
reprodutibilidade, né, dos
script
relatórios. Isso é
will
muito importante para a
allow
gente saber que
for
as
report
avaliações são
reproducibility.
sequenciais.
That's
A
important
gente,
for us to
então,
know that the evaluations are
tem
sequential
dessa forma
in
um
nature.
banco de dados
That
robusto,
allows us to
né,
have a very robust
rastreável através do
database,
audit
which
log,
can be
e que
tracked
a
by
gente
means
vai
of
fazer
the
o
audit
depósito desses
log,
bancos, então, em
and we
repositórios
can
institucionais,
deposit them in
como da
institutional
Fiocruz.
repositories
Então,
such
eu
as
queria fazer minha
Fiocruz's.
apresentação bem
So I'd
breve
like
para
to
dar
make a
tempo
very brief
de
presentation
ter perguntas.
so we can have
Na
time
realidade, então,
for
só
questions.
voltando,
So
não teve apresentação,
there is no presentation, in fact, because all of that is broken down into the details, which includes code availability and availability of some of the applications here, which are in the Fiocruz institutional data repository. So having said that, I'll return the floor back to Larissa. So thank you very much, and thank you all for your attention.
Nós que agradecemos, André.
We are the one to express gratitude to you, Andrea, for having shared a little bit of your experience with us. I was actually preparing myself to share data sets DOI through our chat feature. as André mentioned, I'm going to enter it right now. André's dataset DOI, that includes the codes inside Fiocruz institutional repository, which is called Arcadados. I've shared that through the chat feature here. When I'll get back to Leandro. Leandro Amparo de Souza, we have already introduced him. He is going to do a closing, share some closing remarks, and he will be able to tell you a little bit about software management. So we pass the floor back to you, Leandro. Thank you, Vanessa. Let me bring my presentation back. And with that, I'll be telling you a little bit about the administrative part of REDCap. How can you actually acquire the installation part, as well as some other things, which will include answers to the questions I've already seen, which are shared through our chat feature here. So the questions are going to be asked, likely to be asked during the questions and answers. So I'm going to be talking about some of them right now. This I'm going to skip, because it was mentioned in the previous presentation, which was the introduction. Now, when it comes to the technical part, I'm going to be talking about installation and basic requirements. It's a web application. It's actually a website you can access from anywhere. It's a server software. Once you have that installed, you can actually access that from any browser, any web browser. The question I saw, which is the one I've highlighted in red, REDCap's not something that you can actually download as an app and install that on your personal computer. You actually access that on the web. Again, you cannot install that on your personal computer. It requires both a web server and a database server. And I'll be clarifying that in a while. Network server structure must be in place in your institution prior to REDCap being installed. Though, despite the fact that it's a free software, you have to register and log in. You have to have your basic infrastructure in place in your institution in order to install REDCap. So you have on your machines, on your devices, and people can then access that through the internet. So you have to have a team in place in order to have access to it, so that people can provide some support. So your team can provide that necessary support. Some of the requirements are, it can easily be configured, be set up very easily. All the instructions are included in the REDCap website. I'll show you where you can actually access that and download that. There's a PDF containing the technical overview, and it requires a 725 PHP installed on your server, or anything bigger than that. And there's an Apache, which is the web part between the server and your computer. Or if it's Microsoft, it's going to be a Microsoft IIS. That's a technical requirement of the system for those who understand it. The MySQL is a database server. It could also be the other ones, but the ones we use is the MySQL. We also have an email server. It has to be set up within your institution. It is configured by means of PHP, so REDCap emails can be shared. And it also has to have a file server so that you can store the file in the system. The files that are used in the studies, that will be then stored in these file server. It's recommended to have an IT team in place and a dedicated person for a REDCap dedicated person, which is my case. In addition to the technical part, I also do the other part, how to play the other role of setting up a database and so on. But I am the dedicated individual to manage the REDCap in our institution. It's part of a server setup and updates and everything. Another question I saw is that are institutions independent from their REDCap installation? Yes. Each institution is independent. They provide support to their own installation. The Vanderbilt University, they do not provide support. They will answer questions. If you send an email, they'll send you an answer, but each unit is independent from the university. Each one has to provide support to your own installation. So you're responsible for installing and maintaining and updating and everything.
Passar o próximo. E também é uma coisa que eles colocam na ficha de
Something that they include
inscrição
in
fazer
the
pedido do sistema é essa
application
entrada,
form is
esse exemplo aí, né? Se você não
this
tem
example. If you do not
os
have
recursos mínimos e necessários para a
the
instalação do
minimum
REDCap, eles recomendam que você não
resource to
instale, tá?
set up and maintain
Dados de pesquisa e
REDCap,
saúde
they
são
recommend you do not
importantes.
use it because health research
Isso tem que
data
ser mantido de
are very
forma
important. They
segura
have
para
to be
você,
maintained
para
in
não
a
haver
secure
acesso
manner
indevido e nada disso
to
não
avoid
ser feito, tá?
undue access
O
and to
ideal é que você já
avoid
tenha toda uma equipe,
losses. So
uma equipe já
you have to
para
have a
manter o
team in
REDCap
place
e
to maintain REDCap.
para como adquirir o REDCap, tá? Essa é
Now,
a
how
página do
can you
REDCap,
acquire
sempre teve
REDCap?
essa
This is the
pergunta.
REDCap
A página do
webpage.
REDCap é
The
essa,
question also was shared here. That's it.
www.project-redcap.org. E lá em cima, onde tem aquele linkzinho partners,
www.project-redcap.org.
tem escrito
When you have
Join
this
and Get
link
REDCap.
for
Para você
partners, you have
preencher uma ficha
this
na
possibility
inscrição
of
que você
joining
vai
and
se
getting
juntar
REDCap. So you fill in a form
ao consórcio da REDCap
which will
e
allow
te
you
darem
to
a
join the
licença,
REDCap
tá? O REDCap
consortium
ele só
and will give you a license.
ele só é disponibilizado para
REDCap
instituições
is
de
only
ensino,
made available
pesquisa,
to
instituições
education
que
and
não
research
visam lucro.
institutions, as well as
REDCap,
institutions
você não
which are
pode
not for
cobrar
profit.
para usarem o seu REDCap,
Meaning
né? Então
you
eles só
cannot
vão
charge
disponibilizar
anyone for
o
REDCap
sistema para
use.
essas
So they're
instituições.
going to offer the
É só
system only to these types of institutions. This is an overview of what REDCap is all about. And here we have some
Tem
links
demonstração gratuita, você pode se inscrever
which
no
include
para
demonstrations,
você
demos.
acessar o
So
REDCap
you
durante 2
log
semanas,
in
você
and
ver
then
como o
you
REDCap funciona.
have access for a couple of
Outras
weeks
coisas,
so you
tem
can see how it
mapa do
works.
uso e várias coisas.
There's a
Esse
use map
roadmap
and
aqui, por
and other
exemplo, você
things.
consegue
This
descobrir
roadmap, for
quais
instance,
instituições no mundo
that
todo
allows you
usam,
to
quais
discover the different
existem. Às vezes, a
institutions
sua
using that
própria
across the
instituição já
world.
usa em algum lugar e você não
You may
sabe.
even find
É
that your
interessante,
institution
dá
is
uma
already
olhada.
using that somewhere
Já
else
tive
and
diversos
without you
contatos
knowing that. So it's interesting to take a look at that.
por esse caminho também.
So you can
Aqui ele
access
tem
different
licença
points of
de uso,
contact.
license agreement.
There's a license agreement here as well for
Esse
you.
end user license agreement que é o
And this
formuláriozinho que eu
end
vou
user
mostrar
license
agora para
agreement, which is a
preencher,
form
tá?
I'm going to be showing
Clicou
you
nesse
that has to
link,
be
ele vai
filled in
abrir
in
para essa
advance.
página.
You click on the link and that's
Você
the
tem que
page that
preencher
comes
a
up.
ficha inteira.
You have to fill in the entire
E aqui
entry
eu
form.
botei essa parte só para mostrar
I share this part
o
here
tipo de instituição que eles aceitam,
to show
tá?
the type of institution they will
Academic,
accept.
for-profit, né? Non-profit,
Academic,
governo e
nonprofit, governmental, and others
outros tipos de instituição.
abiding by
E
their
eles levam em média 2
criteria.
semanas para responder a essa
It will
ficha,
take them a
tá?
couple of
Uma vez
weeks
que eles
before they respond to your application form. And once they respond
uma
positively,
conta de usuário,
you will be
você
given
acessar
a
a
user
página do
account so you can
consórcio,
access
e
the
dentro
page
dessa
and
página
the
do
consortium.
consórcio você tem
And that consortium
lugar para
page
baixar o
will
REDCap.
provide a spot for
Tem
you to
instruções
actually
para
download
instalação e tudo isso, mas
REDCap.
assim, essa
There's
parte de
instructions
instalação é
for installation
recomendável
and
que
so
você
forth.
utilize
The
alguém
recommendations
já da
are
sua
that you
instituição
should
que
use
saiba
somebody
essa
from your
parte
institution
de
who's
instalação de aplicações e servidores,
well informed about
REDCap, Apache,
server
PHP, para
installations,
auxiliar na instalação. Para quem
somebody who's
trabalha
experienced in
com
that
isso,
to
as
help you
instalações super simples.
install it.
Você
But
consegue
for those who
colocar
work
o
with that,
REDCap
it's
no
a
ar
simple
em 1 hora.
installation. You can actually
Você
have it
configurar as
running
páginas
in less than an hour,
para
and then
acesso.
you'll have to
Uma
set up
vez que o
the different
REDCap está
pages for
instalado,
access.
tá?
Once REDCap
Nossas
is installed,
atribuições são mais a criação de usuário,
the attributions will
essa página
be
aqui.
user,
E no caso nosso do REDCap,
this
Field
page.
Cruise, a gente
And when it
colocou
comes
ele
to
no
the Field
login
Cruise,
do
REDCap Field
que é pelo
Cruise,
LDAP, você
we
consegue,
set
quem
it
tem
up
um login de
through the
acesso
LDAP as a single
às aplicações da
login.
instituição,
If you have
consegue
login
acessar o
to
REDCap.
any
Se você já
applications in
tem
the
um
institution,
e-mail
will be able to
institucional, por
access
exemplo, você consegue
REDCap. So if you have an
acessar o
institutional
REDCap.
email, for instance, you will be able
Aqui
to
é a
access
parte de
REDCap.
atualizações.
Here is the updates part.
Antigamente, né, a gente tinha que fazer atualizações manuais, a gente
We
baixava
had to do
manualmente
manual
e
updates. So
instalava
we
no
would
servidor. Agora é
download
só
the
clicar num botão
maintenance
que ele faz isso.
manual. And now
Super
all it
simples.
takes is click
E
on a
aqui algumas
button, it will
estatísticas do nosso
automatically
sistema,
update
tá?
it. Here we have system
produto.
statistics for our
Temos
use.
509 projetos atualmente no REDCap, 171 em produção e 332
These are the
em
ones that we
desenvolvimento.
have
Aqui são várias
in production
informações
and be
sobre
developed. And
registros
here we have other information, number of registrations,
tipos de formulários que são usados, tipos de
surveys that have been
projeto.
responded, types of
Temos
forms, types
aqui
of
uma
projects.
coisa que é
What we have
importante
here
também, né,
is
o tamanho,
something
o
that's also very
espaço que o
important,
nosso
which is the
servidor ocupa,
size,
tá?
meaning the space that's
O
occupied
banco de
in our
dados é
server.
25, quase 26
For
GB,
database,
reserve é
it's
quase
nearly
248
26
GB, então no
giga,
total
and web
quase
server
300
nearly
GB
248 giga.
de
So
tamanho
nearly
para o
300
nosso
giga
servidor.
in size
Os logs dos
for our
eventos,
server.
estatísticas de
These
usuários, né?
events,
Temos
user statistics,
2.684 usuários
2,684
cadastrados no nosso
users
REDCap, só
registered
que
in
ativos
our
somente
REDCap, but
855.
only
Então,
855
muitos
are
são
active.
temporários, né?
Many of them
Vêm
are on
por
a
algum
temporary
por
basis,
algum
meaning they
projeto
will log in for the purpose of some specific project, and
depois
then
param de usar e o sistema
they
automaticamente ele suspende
discontinue
esse conta
use,
do
and then the
usuário.
system will
Mais
automatically
algumas outras
suspend this user account
estatísticas.
and a few
Então,
other
dessa parte
statistical information,
administrativa do
pieces of
REDCap, é
information.
isso que eu tenho
When
para
it comes
dizer.
to
Aí
REDCap
meu e-mail,
management,
novamente, quem
that's
quiser
what I
entrar
had to
em
share with
contato
you.
comigo,
My
pode
contact information
mandar
again,
um
if you want to
e-mail, sem
liaise with
problema
me,
nenhum.
please send me
Tentarei
an
responder o mais
email.
rápido
I'll
possível.
try to answer as soon as
Obrigado.
possible. Thank you.
Nós que agradecemos novamente, Leandro.
We are the ones to
né, por
express
todas as
gratitude to you,
informações e
Leandro,
todas,
once again,
né,
for all of the information, all
valiosas
of the
contribuições que
valuable
você e os nossos
contribution you have
colegas aqui
shared with us
do
and our
painel
colleagues here
trouxeram. A gente
in our
chegou no
panel.
nosso limite de hora, né?
We have
A gente chegou
come to
no
our time
limite,
limitation.
então
We
por
did
isso a
have
gente não vai ter, né,
an end
uma nova rodada de
time.
perguntas.
This is why we're not going to have another
Então,
question and answer
queria já,
session,
né, já agradecer a
another
todos
round
vocês
of
que
questions. So
fizeram
I'd like to
parte,
thank
todos os
you,
palestrantes
all
e
of you who
toda a
have
equipe que
participated, to
organizou
all of the speakers, to all of the team
webinário.
that
E
put
dizer
this
que ele foi
webinar
promovido,
together.
então, pela
And like to
Fiocruz,
say
Daily
again that it
Global
was promoted
Network.
by
A gente,
Fiocruz
né,
and
fica
Daily
chateado de não
Global
ter
Network
tempo de ter essa
Networks.
rodada
This is
de
really sad,
perguntas, né?
to go
Mas a gente está
without this
feliz
last
porque a
round
gente
of
viu que tem
questions and
muito
answers, but we are
interesse
very happy because we
no
see
REDCap,
there's a lot of
o que mostra
interest
que a gente
in
pode promover
REDCap. So that
outros
shows us
webinars
that we
nessa
can
temática
promote
e a gente
other
tem
webinars on this
né,
theme
novos
and
eventos
then put
nessa
together new
temática.
events
A
around this
gravação dessa
theme. This
sessão, ela
session
vai
is
junto com os
being recorded,
materiais
then together with the
adicionais,
additional
né, que foram
materials
falados
that were
aqui, eles vão
mentioned
ser
here, that
compartilhados
is
no
going to be
link que está no
shared
chat.
through our
A gente pede que você se
chat, through
inscreva
our
no
links
clube da
that we share
Fiocruz,
through the chat
né,
feature.
e
So
da
please
Global
enroll in
Network,
the
para que a gente possa, então,
Fiocruz
ali compartilhar informações,
network,
desde
and
recursos, webinários e
uh,
atividades, né, toolkit,
we'll have lots of
muitas coisas
information,
que a
lots
gente
of
tem
tools,
preparado.
lots
E
of
eu
materials
queria
that are being
agradecer
prepared, lots
muito,
of
então,
resources. So thank
e
you,
desejar
really,
boas
thank you very
festas,
much.
né, a
And
todos
I
que
wish
estão
you all a
aqui.
very happy
E
holiday
dizer,
season.
né, até a próxima.
And we'll see you next
Então,
time.
gente, boas festas.
Tchau, pessoal.
Thank you
Até a
very much.
próxima.
Have a
Obrigada.
good holiday season.
Ó,
Good
tchau,
afternoon.
obrigado.
Thanks,
Bye-bye.
everyone. Merry
Thank you.
Christmas.